5 causes for having a small penis size. If you are bothered by the size of your penis, if you want to increase it, or if you simply find yourself wondering, why is it small? This video is for you. What can you actually do to improve it? Is there anything effective out there? You are going to discover the 5 main causes, some you are born with, and others that happen over time, and exactly what can be done to improve the situation in each of these scenarios. Stick with me until the end, and let's get into it. There are already quite a few studies and surveys of couples that show more than half of the men interviewed would like to increase their penis size. And let's be clear, this doesn't necessarily mean the man has deep-seated trauma regarding his size. Sometimes, a guy simply wants to enhance what he has. If you ask him, "Do you have trauma about this?" he might say, "No, not really." But if you ask, "Do you want to make it bigger?" he'll say, "Absolutely, if I can." This represents the majority of men interested in male intimate aesthetics. They don't hate their bodies, but they wouldn't mind an upgrade. If it works, great, an extra inch or so would be welcome. If not, life goes on. However, there is another group of men who do carry genuine trauma. This is the man who refuses to use a public urinal, who won't go into a gym locker room, or who won't be naked in front of his wife or husband with the lights on. He prefers intimacy in the dark because he has real limitations. This issue limits him sexually, socially, and deeply affects his self-esteem. So, we have these 2 profiles. Both would like to increase their size, but one is driven by enhancement and the other by a feeling of inadequacy. Regardless of which category you fall into, why is your penis the size that it is? And is it actually small? First, it is crucial to define what small actually means. Medically and statistically, small simply means below the average. A major multi-center study published in 2021, which evaluated 15,000 men around the world, gave us the concrete numbers we use today. This study found that the average length of a flaccid, stretched penis is between 10 to 16 centimeters. The median point is exactly 13.2 centimeters. Now, a very important detail on how to measure this, because most guys get it wrong. To measure correctly, you must take a ruler or measuring tape and press it firmly into the pubic bone at the base of the penis. You have to push past the fat pad until you hit the bone. If you just rest the ruler on the skin, you are losing centimeters and getting an inaccurate number. This is called the bone-pressed technique, and it is the standard for standardization. Without standardization, everyone measures differently, and the data is useless. So, press against the bone and measure to the tip of the glans. If you are within that 10 to 16 centimeter range, you are average. Small or big outside of these statistics becomes a subjective evaluation. It becomes a matter of opinion, yours or your partner's. But objectively, we look at the math. So, knowing that, let's look at the 5 main causes for a penis that is below that average or smaller than you would like. The first cause is congenital. This means you were born this way. The most common factor here is simply genetics. Just like your height, eye color, or hair texture, your penis size is largely a result of the genetic lottery. And remember, genetics isn't just about your father. It comes from the mixture of genes from your mother's side and your father's side. You might be the only one in your family with a certain build, but it's still genetic. Within this congenital category, there is a much rarer cause involving hormones during pregnancy. Embryologically, the glands of the penis and the clitoris have the exact same origin. In the womb, we all start the same. At a certain point in gestation, a male fetus experiences a significant testosterone spike. This hormonal peak triggers the development of the male sexual organs. If the mother takes certain hormonal medications during pregnancy that interfere with this testosterone spike, it can lead to malformations or a smaller penis size. Again, this is very rare, but it is a biological possibility. Another congenital issue is structural, specifically regarding the urethra. Conditions like hypospadias or epispadias occur when the opening of the urethra isn't at the tip of the penis, but rather underneath or on top of the shaft. This often comes with a tethering effect, a curvature or internal scarring, that prevents the penis from stretching to its full potential length. Moving on to the second cause, we enter the realm of acquired causes, specifically post-operative changes. This applies to men who have undergone surgeries in the pelvic region. The most common example is a radical prostatectomy, which is the removal of the prostate due to cancer. When a surgeon removes the prostate, there is a gap left between the bladder and the urethra. To reconnect them, the surgeon has to pull the urethra up to the bladder and stitch them together. This tension, this traction required to close the gap, physically pulls the penis inward. It is very common for patients to lose 1 to 2 centimeters of visible length after this surgery. Similarly, a urethroplasty, surgery to fix a narrowing or stricture in the urine channel, can have the same effect. The surgeon cuts out the bad section of the urethra and sews the healthy ends together. Once again, this creates internal tension that can retract the penis. In these postoperative cases, the fix is largely about rehabilitation. We use penile traction therapy, extenders, and vacuum pumps in the recovery phase. This physical therapy helps to stretch the tissue back out and recover some of that lost length. It's crucial to start this rehabilitation once the catheter is removed and the doctor gives the all clear. The third cause is something that usually affects men a bit later in life, typically over 50 or 55. You might notice that over the years, your penis has started to curve or bend, and along with that curve, it has gotten shorter. This is likely Peyronie's disease. Peyronie's is characterized by the formation of a fibrous plaque, scar tissue, on the tunica albuginea, the sheath that surrounds the erection chambers. This scar tissue is not elastic. It does not stretch. So, when you get an erection, the healthy tissue expands, but the scar tissue doesn't, causing the penis to bend, buckle, or simply retract into the body like a telescope. Severe Peyronie's can cause a man to lose 3, 4, or even 5 centimeters of length. It can be devastating. In these cases, the solution often involves treating the curvature. If the curvature is stable and the erection is still strong, we can sometimes use modeling procedures or traction therapy. In severe cases with erectile dysfunction, a penile implant might be the best option to restore both length and rigidity. The fourth cause is one that has gained a lot of attention on the internet recently, often referred to as penile disuse. It sounds like a myth, but the concept is medically sound. Use it or lose it. To stay healthy and elastic, the penile tissue needs oxygen. The penis receives its best supply of oxygenated arterial blood during an erection. This is why healthy men have nocturnal erections. It's the body's way of running a maintenance cycle. If a man stops having erections for a long period, let's say 6 to 8 months, due to severe depression, celibacy, or nerve damage after a surgery, like a prostatectomy where the nerves are stunned, the tissue stops getting that high-quality oxygen. Without it, the healthy elastic tissue begins to turn into fibrotic, inelastic tissue. The penis literally shrinks and loses its ability to stretch. This is most commonly seen in older patients or post-surgical patients who suffer from neuropraxia, temporary nerve paralysis. They stop getting morning wood, they stop having sex, and a year later, they realize they have lost size. The fix here is prevention. Maintenance of erections is key. If you aren't having them naturally, we use medications like tadalafil or vacuum pumps to force blood into the tissue and keep it oxygenated and elastic. However, I know that for many men, the idea of relying on pumps or risky pills with side effects is a deal breaker. If you want to address that lack of oxygen and blood flow naturally, there is a fascinating presentation you need to see. It reveals a bizarrely simple, 7-second morning ritual involving a specific purple hardening tonic. It's 100% natural, and thousands of men are using it to reverse that shrinkage and restore thick, rock-hard erections without dangerous drugs. If you want to see exactly how this tonic works to oxygenate the tissue and bring your performance back to its prime, scan the QR code on your screen right now with your phone's camera. I've also pinned a link to that video at the very top of the comments section below. Do not ignore your blood flow. It is the life of your penis. Finally, the fifth cause. And this one might be the reason you are watching this video right now. It is called penile dysmorphia. This is the patient who has a completely normal penis. He measures 14, 15, or 16 centimeters, often well above the average. But when he looks in the mirror, or when he compares himself to what he sees in adult films, he is convinced he is small. This isn't about physical measurements, it's about psychological perception. This man often avoids relationships, sabotages romantic connections, or lacks confidence in his career because he feels less of a man. He focuses all his anxiety on this one body part. For this patient, surgery is rarely the answer. If you perform a lengthening procedure on someone with dysmorphia, they will likely still be unhappy because the root of the problem wasn't addressed. The treatment here is primarily psychological, helping the patient align his self-perception with reality. However, for men who just want a boost in confidence and aesthetic improvement without invasive surgery, non-invasive procedures like hyaluronic acid fillers can help increase girth and flaccid length, which often improves the locker room look and self-confidence. So, in summary, if you are looking to fix a small penis, you first need to identify the cause. Is it genetic? Is it scarring from Peyronie's? Is it atrophy from disuse? Or is it a perception issue? For physical length restoration, penile extenders, traction devices, are the gold standard for non-invasive treatment. They work by applying constant low-level tension to stimulate cell division and tissue growth. For post-op recovery, vacuum pumps are essential. And for aesthetic volume and flaccid length, fillers are a modern, safe option. If you are concerned about your measurements, grab a ruler, use the bone press technique, and see where you actually stand. Understanding the reality is the first step to fixing the problem.